Hello, I'm Kevin Durkee, and it is my pleasure to review the response to COVID-19 by the Business Analytics Department. It is an honor to speak to the leadership of the Bassett Healthcare Network. Each of us were a part of Bassett's response to COVID-19, and I thank you for allowing me to share examples of the analytic tools that were brought forward on behalf of the organization and patients we serve. On March 12th, the first patient at Bassett Healthcare Network tested positive for COVID-19. The next day, Dr. Hennigan, our Chief Clinical Officer, pulled me aside in the Fieldstone conference room and said, "We're going to need a ClickView app for COVID." At that time, the team and I didn't know what information relating to COVID was housed within our Epic EMR system. We didn't know the difference between the clinic screening tents that were being brought online versus the external evaluation areas that were being stood up outside of our emergency departments. There was no playbook for this. But within 6 days, we had a working ClickView app up and running. The kids like to use app instead of application. That app met Dr. Hennigan's needs, and it was deployed to physician leaders and hospital administrators as they moved forward to meet the situation. I'm proud of the work the team has done, and I'm proud to be a part of a leadership team that served its patients and communities so well. Some of you are already familiar with ClickView and data visualization. Others may have heard of it. I'm going to show you the information needs that arose during the COVID-19 situation and how ClickView was used to meet those needs. I'm also going to review what data visualization is and what it is not. And finally, I'm going to demonstrate some of the other ClickView apps that were built outside of COVID-19 and ask that you consider how data visualization can benefit your area. I'll be speaking for a few minutes and it will include some slides. I ask that you hold your questions to the end and I'll be happy to answer them at that time. The first app that you see is the Pandemic ClickView app. It leverages 22,000 tables that we have access to in the Epic EMR system. This is where data is stored at the granular level, and it is our job to transform that data into information and convert that information into knowledge. On the upper half of the screen, you see a cumulative line total of patients that have tested positive at the Bassett Healthcare Network. On the lower left portion of the screen, you see a bar graph that shows the county of origin for those patients that have tested positive. The lower right shows the city of origin for those patients. At a glance, a user can see that 263 patients have tested positive at the Bassett Healthcare Network, and that Herkimer County had the highest total positive COVID patients of any county in our service area. One of the benefits of using a visual tool like ClickView is that I can quickly explore something like comorbidities among this population. On this slide, we can focus on the far right column and see that there are more instances of hypertension versus any other comorbidity. Using the filters on the left-hand side, we can further explore comorbidities by county, by age band, and by Bassett PCP, or any combination of those. This is a very powerful tool, and it doesn't require any additional reports to be developed to obtain information. The next ClickView app on screen is the My Bassett Activation app. Video visits became essential for Bassett during COVID-19. Patients didn't feel safe coming to their doctor's appointments. We experienced thousands of cancellations in late March and throughout April. The only way for patients to access video visits to see a Bassett physician is through the Bassett portal, My Bassett. For years, the patient portal had a modest adoption rate. The Bassett Medical Group launched an all-out effort to get as many patients signed up with an active My Bassett account as possible. They needed a way to gauge and track their efforts, as well as a way to identify patients that had an upcoming appointment that did not have an active My Bassett account. On this slide, you see a daily bar graph of My Bassett activations. You can see that we were averaging about 50 to 60 new activations each day up until late March 2020. On March 23rd, you can see that we started averaging 250 to 300 new activations each day. We took data, turned it into information, and now we know, we have that knowledge, that the Bassett Medical Group is successful in their efforts in converting pending MyBasset activations into active MyBasset users. Identifying patients we can contact in this example. This slide displays patient medical record numbers for those that have a pending MyBasset account and have an upcoming dermatology appointment 7 to 21 days from now. These patients can be contacted by virtue of these selections, and they can be asked, would you like to see your dermatologist from the safety and comfort of your home? All you have to do is activate your MyBasset account. I've used the term data visualization. You're asking yourself, what does that mean? Basically, it's charts, tables, and graphs. You're consuming data with your eyes, you're making relationships between data points, and you're establishing hierarchy between that data. If we do our jobs effectively, you'll need to know what you need to know at a glance. This is done by employing visual design best practices. There are books and courses on this subject, and my team studies this at length, but there's a few things you can take with you today. We remove all non-data pixels. This includes borders for charts, cute graphics that don't display or convey any information that you would need to know, and redundant chart headings. This would be a sign pointing to another sign, telling you that you're looking at a sign. We take advantage of white space and take a minimalist approach to design. This allows the data to really stand out. You want the data to stand out because that's what you're looking for. We never use pie charts. I've banned them from my department, and so should you. The human eye has trouble distinguishing between data elements once the pie chart has more than a few elements. Instead, we've moved to histograms and Pareto charts, and there is a lot of literature on reasons why. I give you this brief explanation of data visualization to underscore that it goes beyond static standard reports. Outside of COVID-19, we have been successfully deploying ClickView apps to patient center medical home, to finance, to billing. We also have a ClickView app that hooks into the Care Advance database for patient progression on the inpatient floors. The apps are built for the end user and the departments and programs I mentioned to gain knowledge from our source systems and to better serve our patients and to effectively meet our mission. I invite you to consider, what information are you trying to get, and what is it that you're trying to know, and how can data visualization help? In closing, we've come a long way since March 12th. We were challenged as an organization and as a department. This also allowed us to do some of our best work. ClickView, with its data visualization and data exploration capabilities, has proven to be a very powerful tool for the Bassett Healthcare Network and for all of you. The Business Analytics Department developed a great suite of tools to respond to COVID-19. We have competent, passionate, and dedicated people in the department. We are very well prepared and positioned for the next time Dr. Hennigan or any of you pulls me aside in the Fieldstone conference room and tells me we need a ClickView app. Thank you.